Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off this case. This is a case, an example where I love using Invisalign, and I'll explain why I like Invisalign better than braces for these types of bites. This here is Abigail, and Abigail came to us just looking for a nicer smile. I'm going to show you a little bit more about what's happening in Abigail's mouth here as we explain it. You can see that we have some crooked teeth in the front of the mouth. You can see that the upper front teeth are overlapping the lower front teeth such that you can't see but about half of the lower front teeth, maybe even less in some cases. This is a situation that we call a deep bite. Deep bites are problematic because when there are deep bites, the upper and the lower front teeth are hitting too hard usually, and the lower front teeth are sustaining forces that they really shouldn't be taking, and the lower front teeth get worn down. Over time they get very, very worn down, and then it becomes a big problem because you can't put crowns on them, you can't restore them, they're just worn down. So we try to protect those teeth by showing more of the lower front teeth. And in this case, she's probably not hitting on those teeth super hard right at this moment, but you'll see the changes that we make in that. All right, the other thing that was happening here for Abigail was the way that the bite fit together in the back of the mouth. And first I wanted to show you the left side of her mouth, which I actually liked the way that they fit together. So I like the relationship of these two molar teeth right here. The canine teeth are not in perfect relationships, but it's pretty good. And in layman's terms, the teeth zigzag. So if you follow my little mouse here, they zigzag like this. And that is how a good fitting bite should fit together. So this side of the bite actually looks great. But on the right side, the bite does not fit together as well as it should. And so this is the situation that I really like using Invisalign as opposed to braces. Let me show you how this side doesn't quite fit together. So if you look at the red lines back here, these red lines should coincide. So the cusp, the little mountaintop of this top tooth where the red line is, that should fit right in the middle of this lower tooth. And you can see that we're quite a ways off. This is probably the magnitude of like 6 millimeters off. And these blue lines up here, so the upper canine tooth, the point of it should sit kind of right down in between these two lower teeth. And we're probably about 7 millimeters off. And the consequence of having a bite that fits together like this in the back of the mouth is that you end up with a large overbite in the front of the mouth. So the distance from the upper front teeth to the lower front teeth is significant. This is probably 6 to 7 millimeters. And in her case, the upper front teeth flare out, so they stick out, making it look even bigger. And so part of our objective here is that we want to fix the bite in the back, because as we fix the bite in the back, the overbite in the front will go away, and then the teeth in the front can fit together like they're supposed to. So how do we fix that? Well, if we think about these red lines coinciding, you can have the upper teeth move backwards and you can have the lower teeth move forwards. I demonstrated that same thing with the blue lines for the upper canine tooth and where it should sit on the bottom. We make this change happen by wearing rubber bands. And so my black lines here are just a schematic of how we wear rubber bands. And this is how we wear rubber bands, whether we use braces to move teeth or whether we use Invisalign to move teeth. They both will work. And the mechanism of action here is that when you wear a rubber band like this, there's a backwards pull on the top teeth, which is what we want to see happen if you look at these blue and red lines. And there's a forward pull on the lower teeth, which is exactly what we want to see again if you look at the red and the blue lines. So the rubber band is what powers the movement for this bite correction to occur. And again, that happens whether it's true in braces or with Invisalign. But the thing is that when you wear a rubber band like this, there is a backward pull on the upper teeth and there's a forward pull on the lower teeth, but there's also a downward pull on the upper teeth. And that's because when you consider this vector of the rubber band, there is a horizontal component and there's a vertical component to it. And this downward pull is what has some consequences to it. So when you have the rubber band, so again, I've drawn the rubber band on Abigail's right side, and you have that backward pull and this forward pull, you also have this blue downward pull. And what happens when you pull downward on one side of the mouth, but not on the other, because we wouldn't be wearing rubber bands to correct a bite that doesn't need correcting, then you can end up with what we call canting of the occlusal plane. So canting basically just means that the front teeth get crooked. So sometimes the upper front teeth come down further on the right side in this situation and up a little bit on the left side. and it just makes the whole smile look crooked. And this is a side effect that can be hard to control if you're wearing a lot of rubber bands on the right side and none at all on the left side. There are some ways to get around it, but what I really love about using Invisalign is that Invisalign covers the biting surfaces of all these teeth. And the Invisalign aligners mitigate this downward force that I have a 2 drawn next to. And so because it mitigates that side effect, it tends to be a great modality for when we have bite correction on one side and a good looking bite on the other. Now, just for the sake of completeness, the other thing that happens when we wear rubber bands in these situations where the bite is incorrect on one side and correct on the other is that the midlines, the middle of the upper front teeth and the middle of the lower front teeth, will also move and be closer on. So that red line should match up with that red line. As we wear the rubber bands on the right side of the mouth, the upper midline will move to the right side and these lines should coincide, and you'll see that in just a second. But again, the takeaway point here is that Invisalign is a great modality in this case for taking away a side effect that would otherwise occur with great significance in braces, and that's because we have just the bite correction needed on one side. So here is where we finished with Abigail's bite, and you can see that these red lines are just perfectly coinciding. The blue lines are not perfectly coinciding, but the sizes of the teeth don't always let them fit together exactly as you might think they should. Also, the angle that you're looking at this affects it. If you looked at it from a different angle, you would see these blue lines corresponding. But this is an amazing finished bite on the right side, and the magnitude of change to change this bite for about 6 to 7 millimeters, that's a huge magnitude of change. And I really give Abigail a lot of credit for being a great patient and wearing her rubber bands diligently because, again, those rubber bands is what powered this change. So what an amazing change that she achieved there. You can see if we look at the front teeth, the red lines actually used to be the opposite relationship. So they are very close to coinciding. They're not perfectly coinciding. Again, sometimes the sizes of the teeth don't fully allow for that to happen. And then I drew these blue lines just to demonstrate that all these upper teeth are kind of more or less straight and on the same plane as we go from right to left and left to right. So there is no canting. They did not get crooked because of the rubber band wear. And that's because, again, the Invisalign aligners mitigated that side effect. So again, here's our nice finished product. Here is Abby smiling at the end of treatment, and I am just so proud of this girl. She was an amazing patient, did everything we asked in terms of wearing her aligners and wearing her rubber bands perfectly. And so thought I'd show you a few side-by-sides of where she started and where she finished. This is the frontal view, where she started and where she finished from the side. Again, that is an enormous magnitude of change, and we should be very, very proud of that. And then, of course, most importantly, just the difference in her smile from start to finish. So this case, again, was done with Invisalign. It took about 1.5 years, so 18 months from start to finish. We did actually 4 sets of aligners, so 1 big set in the beginning and then 3 small sets to just tie up some little loose ends and make some minor corrections to make everything perfect. And so to complete this in 18 months is something that I'm very proud of. That's a great treatment. She was in office 9 times total from start to finish. One of those times was because something was broken. The other 8 were her regularly scheduled appointments, and that was because of our JFO on the go remote monitoring program. Allowed her to come into our office for fewer visits, but allowed us to keep better track of her during her treatment, so we could actually see her every week and monitor her progress with each aligner that she changed into. So big credit to our JFO on the go program for helping Abby to a successful treatment. And again, congratulations, Abby, on your beautiful smile. You were a fantastic patient, and we are so proud of you. So anyway, hopefully you take away from this that Invisalign can be a great treatment modality when there's bite correction needed on one side and not the other. Invisalign also did a great job of making sure that we have less overlap of those front teeth. So again, if we go back here, you can see how we can see a lot more of the lower front teeth than we could when we started, and that gives us that nice healthy bite relationship so that the lower front teeth don't get worn down. If you have any questions about this or braces or Invisalign as modalities of treatment, please let us know. We'd be happy to take care of you and your loved ones as well. All right, take care. Bye.